Mr. President, across Illinois, families are opening up their mail and confronting a painful reality. Health care is becoming very difficult to afford. For millions of Americans who buy their own insurance through the Affordable Care Act, the problem became much worse this year after the Republicans on the other side of the aisle allowed enhanced premium tax credits to expire. These credits help working families afford coverage, especially people who do not get health insurance through their employer, including small business owners, independent contractors, and farmers. The average monthly premium for people buying coverage for the ACA Marketplace health insurance increased by 58% this year alone. And many Americans have been forced to switch to plans with higher deductibles just to keep their monthly premium within reach. Others have dropped health insurance altogether. ACA enrollment in my state dropped by 15% because premium costs push my constituents out. For farmers, this health care affordability crisis is particularly painful. Farming is not a 9-to-5 job with a benefits package. Many farmers are self-employed. At the same time, President Trump's war in Iran and reckless tariffs, a version of which he reinstated last week after the Supreme Court struck down his batch of effort, are squeezing American farmers and farmers in Illinois. The cost of diesel fuel, fertilizer, and equipment have all skyrocketed. Now, health insurance is added to the list. National Public Radio in Illinois recently told the story of Ben and Paula Steffen, lifelong farmers in Nebraska. Last year, they paid $13,000 annually for health insurance after receiving support from Obamacare, ACA's enhanced premium tax credit. This year, after congressional Republicans refused to extend those tax credits, the Steffens can expect to pay $32,000 annually for coverage, more than double the $13,000 they paid last year. They moved to one of the cheapest plans available. It still carries a $7,200 deductible. It's not just the Steffens in Nebraska. I heard directly from farmers in Illinois who report the same or similar health insurance price hikes. Ben is a farmer from McLean County, self-employed, buys health insurance for himself and his family and their daughter. He told me his family is healthy, but their health insurance now costs $1,458 each month. That's nearly $17,500 annually, just in premiums. Ben told me, quote, "Health care is drowning me." He went on, "That's crushing me. Something has to change." Think about it. A farmer working to support his family and feed this country is paying almost $17,500 a year just to keep his family insured. Yet instead of lowering these costs, President Trump and congressional Republicans have spent the past year making the problem much worse. They allowed ACA's enhanced premium tax credits to expire, despite repeated warnings about what it meant for families. And they slashed $1 trillion from the program called Medicaid. That's a program which is critically important. Think about this for a moment. Every other birth in my state of Illinois is paid for by Medicaid. 70% of the men and women who are in nursing homes in my state are covered by Medicaid. And now the Republicans have proposed slashing $1 trillion from Medicaid in their so-called Big Beautiful Bill, despite pleas from rural hospitals and others that these cuts could be devastating. Rural hospitals are the economic engines of many rural communities, the biggest employer, one of the most important businesses in town. They operate on razor-thin margins and serve a larger share of patients who are uninsured or covered through public programs. As more people lose coverage, rural hospitals and clinics face even greater pressure to cut services. I've seen it happen in downstate Illinois. Hospitals in some of the larger towns have announced that they're no longer going to provide OB/GYN services, as an example. For a farmer who may already live miles from the nearest hospital, losing that local hospital or a local clinic, a maternity ward or emergency department can literally be a matter of life or death. Instead of building grand ballrooms on the White House, outfitting new aircraft as Air Force One, and starting an unnecessary war with Iran, the president should be focused on what matters most to Americans, bringing down the cost of living. We should immediately restore the enhanced premium tax credits that made coverage affordable and protect Medicaid in the rural hospitals that communities depend on. We should also be working together to lower health care costs, not forcing farm families or other families like Ben's to shoulder thousands more in cost each year. Ben told me, quote, "Something has to change." He's right. In less than 100 days, he'll have his chance to speak as an American about the future and whether we can put up with what we've seen so far. Senate Democrats will keep fighting to make quality health care more affordable and accessible for all, including the farmers, rural communities, and working families across Illinois and America. Mr. President, I yield the floor.